Allah created like that. They cannot take vaccine, but they are protected. And this is called herd immunity. Then this is a very important understanding for investment in vaccination for akhirah. This is a very, if you don't understand what I'm talking about, herd immunity is opportunity to upgrade the profitability of vaccine for akhirah. This is extra credit in your intention. Now, what is the challenge of vaccine? Right now, there are many challenges, but one of them to zero in is about variants. One of them to zero in. First of all, this is the life cycle of the virus. Illustration. This is the S protein. This is ACE2. The S protein has to bind to ACE2. Pairing. Everything from here, this pairing, until every step in the cell, until get out. Everything is pairing. It's a Quranic theme. It's a very Islamic theme. So the virus actually walking the Quranic words, literally. We can discuss that more. Now, the problem is when the vaccine is again this S protein. When the variant has the changes on the S protein, then you have a problem. For example, this is 2 weeks ago. I'm in charge now I have a very peculiar job. Most people running away from these viruses, or at least the best they can take vaccine. My daily activities from the moment that we have the outbreak in January last year, my job is to go to the viruses, growing it up. I have enough hundreds of isolate deadly stuff in my fridge, in my freezer that is. And one of the now my challenge is to hunt for the variants. So this is UK variants in the US from California. So this is the happy cell. This is unhappy cell. This is a dead cell. This is another one from UK one from Texas. I'm going to show you this is a healthy cell. This is 2 days. So you can see some unhappy cell. By 8 days, everything is done. So and this has happened in our body, in our lung. That's one reason why it's a deadly. So this variant, this is what variant does. So this is a cartoon of the virus. This is your the genome, the gene, the RNA. This is the, if you open it up, this will look like this. This is the S protein gene here. And there are many, many changes. I'm going to show you what it does. Now, let's say this particular mutation here. See, the S protein work not in monomeric, it has trimeric, it together, like trimeric, homologous trimeric together, and they change here. So when it change here, it might problem in pairing to your receptor. Another change here, deletion. Deletion, I mean the amino acid is gone. This is 2 amino acid gone. Now it affects the structure here. Now there's another acid here, deletion, another 144, 144, another 2 deletion. It affects this wing here, right? And you have mutation here, it affects on here, on the structure of the S. So this is the S protein of the virus. So what I mean is, that is this action, that is something happened, there's a consequence. So because of the mutation, the worry is the vaccine doesn't work. But alhamdulillah, using that California UK variant that we have a preliminary study with the collaboration with the Emory University Medical School, because Emory has the luxury of people who are sick, they have patients, so they have their serum. Also, Emory have a vaccination program, so they have vaccinating serum, and that's why you can study it. And the good news is, the bottom line is, the UK variants still are neutralized by the vaccine, the antibody in the vaccine. Alhamdulillah. But theoretically, it will come. There will be no more, like it keep on decreasing the protection. How you do that? How to solve these challenges? We'll discuss. If you ask questions, we can discuss about that. Now, the challenge of the vaccine is much more insidious. It's more problematic. Why? Virus is very easy. These challenges is in the heart of people. These are problematic in the heart. That is heart in action. People don't believe there is a real virus. People don't believe in vaccine. And we can discuss this in many, many different versions. And Muslims are infected with the diseases. The disease of the heart, not with the disease of ignorance. Ignorance of knowledge that Allah blessed to humanity, that is scientific knowledge. Or we are confused. And worse is, we are realizing, based on my my study, we have become enabler, helping this kind of illness. And some of them are very famous, Oxford educated, Cambridge educated, are the agent of this problem. That's the problem. But I'm going to share to you is, this is the way the vaccine is produced. All the vaccine. It's not just COVID-19 virus vaccine, but it's all the vaccine. Make sure I have time here. Okay. All the vaccine follow this, the way how to develop. And the most critical thing is the clinical phase and the review before you have certification. These are very Islamic. It is very important. Knowledge and every verification is a very, very important. And this is what clinical trial all about. Well, I have to be truthful. I talk about vaccine. I take my own vaccine. So I believe in a vaccine. So this is I'm going to tell you my story. I took my vaccine in January 21st. And they follow me up until last Thursday. So every day I have to say this. I say, you feel good? I said, good. Alhamdulillah. Then you say the fever. Then check for the symptom. These are the possible symptoms that I can expect. I have none. Alhamdulillah. This is another symptom that I may have. I don't have. Alhamdulillah. Then done. And I'm using a Moderna. So this is a very historical moment for me as a scientist, because this mRNA vaccine is it's nothing new, but it is the first time in the history of humanity for a vaccine. Vaccine work. Why? I'll give you an example. An island, this 1950, measles killed nearly 700,000 people in 1950. All this, the bigger the 2019, the vaccine program, gone. So vaccine work. The data is there. And Muslims need to know this. Now, what is life after COVID-19, right? I know it's tough. This in Egypt, in distance. You cannot socialize. This is very sad. The sad thing is when a parent is sick, dying, you're dying alone. For example, the daughter cannot enter it because you cannot enter it. This is a nursing home. The hospital worker, overburdened. So think about them, make dua for them. Professor, zero. You study at home, right? Everything Zoom, alhamdulillah. Travel close, quarantine, isolation. It's tough. So what's next? What's life after post? So the question is, what life post COVID-19 is a wrong question. That's called long hope. The good question is how to live my life now, and moving forward. This is the problem that I'm to this is my perspective. The problem with us as a Muslim, we view science as one box and Islamic knowledge as one box. That is inaccurate. This is better in terms of knowledge. Science and Islamic knowledge, there are some similarity. They can agree in terms of knowledge. But because the epistemology is different, they cannot be identical, right? Because science is physical knowledge based on matters, atom, structure. Islamic knowledge, that is maratib of ilm. You have senses, you have intellect, you have imagination, and you have revealed knowledge that is the highest. Even in the kingdom, there are maratib of kingdom. In science, only one, physical universe. For a Muslim perspective, we have physical universe, al-mulk. Yes, we accept that. But there's a higher thing. They call it al-malakut, the spiritual world. Then higher in that, called alam lahut. Only Allah exists. So there are three existence of level. So we have to, my point is, our final worldview have to be science within our Islamic knowledge. Because Islamic knowledge is the biggest, the highest. That's why the scholars, ulama, is the highest, the most respected people in the Quran, in our tradition. But unfortunately, we are not putting them, and they don't know their status, or they're shy. So I'm as a scientist, I try to put the ulama on that envelope. I'm under the ulama, right? So we can discuss this more about this. But I like to stress this: science and scientism. Science is Islamic. Science is Islamic from Allah. Scientism is satanic. Scientism is a philosophy that you view whatever you see, the only one exists. That is scientism, secular. That's wrong, we reject it. But science, alhamdulillah, is part of knowledge. So how to do moving forward? You go back to the word I recited. Life is a business. So it's a business. So every morning when you wake up, you have business with your soul, right? Whether you profit your soul or you lost your soul. In other words, make your soul go to paradise or go to hellfire. If that's not sophisticated, we are living in time. So we have to be cognizant about the owner of time. So the owner of time, Allah Ta'ala. So this is the definition of how to be successful. Recognize the owner of time and act. Knowledge, iman, and action. In a nutshell, this is the most important tool of our moving forward. Take care of our nafs, of our qalb. Your body healthy is good. But if your nafs, my nafs is wrong, is unhealthy, no good. Because my body will be buried in the ground by my wife, by my children, when I die. But my soul will move forward. And this is important to understand. So moving forward then, even though we discuss about science, you have to seek knowledge to be certain who am I, where am I, and where I'm going. Second, know my own soul, the sickness of the soul. If I know much about the sickness of COVID-19 and I don't know about the illness of my own heart, I'm doomed. I'm failed, literally. And the last one, I have to focus. You have to focus. I advise myself first, and you, as a student and adult, to focus on the purification of that heart. Knowledge, action, make dua, how to implement it, and keep on repeating that. Repeat. That's why I said, repeat to the power of X. X equal death. You do that until we die. And that is the way we move forward from now on. Not to wait, because to wait is satanic trickery. I'm going to stop there. Whatever I've said is correct, is from Allah Ta'ala. Allah give me the pleasure, the privilege, the knowledge of science. Whatever my mistake is from myself. May Allah consider whatever we have discussed as a good deed and make us among the people of knowledge, people of amal, and people of always relying after doing our best on Him subhanahu wa ta'ala. And I will end with the translation of the dua that I made in the beginning. It means it's good adab for a Muslim to speak, to discuss about knowledge and about thing in the presence with where it comes from. Allah, you are my Lord. There's no Lord, nothing else beside your Lord, beside you. I trust, I tawakkal to you. You are the owner of Arsh. Arsh is the bigger than anything else, right? Arsh. Whatever you will, happen. Whatever you do not will, never happen. There's no strength in anything except you. I know that you are over everything else. Your power, Allahu Akbar, over anything else. And I knew for certainty that everything, your knowledge encompasses everything, and you enumerate everything in numbers. Therefore, I beg you, I ask you protection from my own enemy, myself, and I seek protection from everything, including COVID-19 and every evil, especially the shaitan and the friends in jinn and human being, which you have control on the forelock. I seek refuge from them, from you. Indeed, you are my Lord. You are in the straight path. Just like when we say, Ihdina siratal mustaqim. Wallahu alam. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Yeah, jazakallah khair, Dr. Azaibi, for your presentation that there is really enlightening. Dan saya ucapkan selamat datang kepada para peserta yang baru saja hadir, baik melalui meeting Zoom meeting ataupun melalui YouTube dan Facebook. Mungkin saya akan menjelaskan sedikit poin-poin penting dari presentasi Dr. Azaibi. Barusan saja Dr. Azaibi menjelaskan basic tentang infectious disease that caused by virus, bacteria, and other various agents. Dr. Azaibi juga menjelaskan mengenai vaksin, gitu ya. Kemudian berbagai different system di dalam tubuh kita, di mana tubuh kita memiliki two kind of adaptive system yang meliputi B cell and also T cell. Kemudian Dr. Azaibi juga menjelaskan poin penting mengenai herd immunity yang bisa kita capai melalui vaksinasi gitu. Ketika di dalam populasi banyak yang divaksinasi, disease cannot spread very far, so the whole community stays safe. Kemudian juga Dr. Azaibi menjelaskan mengenai virus cycle gitu ya. Kemudian juga ada varian baru dari UK gitu ya, yang ini menjadi sebuah tantangan dari proses vaksinasi kita pada hari ini. Kemudian juga yang juga penting adalah Dr. Azaibi menekankan bahwa science is also part of Islamic knowledge. Gitu. We cannot separate between science and Islamic knowledge, and we are as a Muslims, we have a responsibility to discuss and speak about the truth of the knowledge. Dan kemudian kita juga akan melanjutkan diskusi lebih dalam di Q&A session nanti di akhir setelah dua pembicara menjelaskan materinya. Kemudian selanjutnya kita juga mempunyai pembicara yang sangat luar biasa. Ada Dr. Alvin Syah Pramono. Saya akan membacakan sedikit biodata beliau. Dr. Alvin Syah Pramono saat ini telah menyelesaikan studi masternya di The State University of New Jersey dengan gelar Master of Science in Clinical and Translation Science. Kemudian beliau juga menyandang gelar Masters in Pharmacy with the field of Drug Discovery and Development di Universitas Padjadjaran Bandung. Beliau juga menyelesaikan studi kedokteran di Unpad, di alma mater yang sama. Kemudian saat ini beliau adalah Ketua Permias Persatuan Mahasiswa Indonesia di Amerika Serikat, yang senang sekali ya IMSA saat ini bisa bekerja sama dengan Permias untuk mengadakan webinar ini. Beliau juga di tahun 2020 menjadi Ketua Satgas COVID-19, Permias Nasional COVID-19 Response Team. Begitu. Ya, Dr. Alvin Syah Pramono pada hari ini akan menjelaskan banyak hal mengenai rollout COVID-19 vaksin di United States dan peluang apakah international students bisa mendapatkan vaksin tersebut di sini, dan juga kita juga ingin belajar gitu bagaimana kita sebagai seorang pelajar juga seorang yang well educated gitu ya untuk bisa membantu mengkampanyekan vaksinasi ini kepada masyarakat secara luas. Ya, kepada Dr. Alvin saya persilakan.
Baik, terima kasih Mbak Adia selaku moderator. Bapak Ibu sekalian, Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi waktu Amerika Serikat dan selamat malam waktu Indonesia. Pertama-tama saya mengucapkan terima kasih kepada Mas Iksan dan rekan-rekan dari IMSA, Mbak Dia, Mas Faisal yang mengundang saya juga untuk boleh sharing hari ini. Hari ini saya ditugasi oleh teman-teman IMSA untuk sharing mengenai update mengenai vaksin COVID, lalu dengan memasukkan beberapa hasil-hasil trial terbaru, dan juga kita lihat bagaimana opportunity untuk distribusi vaksin, baik itu di Amerika maupun secara umum di Amerika, maupun juga bagi para mahasiswa internasional. Saya akan share screen saya. Oke. Bentar ya. Apakah sudah terlihat presentasinya?
Ya, sudah.
Bentar. Di saya masih gantung soalnya. Oke. Oke. Jadi terus terang karena ada Dr. Azaibi, thank you for sharing and reminding me of the basic science of the microbiology again, Dr. Azaibi. Dan hari ini kita akan banyak bahas mengenai bagaimana rollout plan dan policy di US, juga untuk university students, dan juga bagaimana mengkomunikasikan campaign yang baik. Jadi kalau dari sisi medis, saya dari dulu selalu belajar bagaimana sesuatu informasi yang disampaikan kepada orang itu harus evidence-based. Nah, oleh sebab itu, hari ini sebagai bentuk bagaimana kita bisa mengkomunikasikan campaign yang ada, saya akan mencoba untuk meng-guide teman-teman bagaimana kita bisa memahami data-data ataupun hasil penelitian medis, hasil-hasil clinical trial yang sudah dipublikasi dan kita bisa cermati bersama-sama. Gitu ya. Oke. Tujuannya dari pada waktu mungkin 3 hari yang lalu CDC mengeluarkan rekomendasi terbaru lagi mengenai pemberian vaksin COVID-19 dan bagaimana strategi pemberian vaksin di Amerika Serikat. Tujuannya adalah satu, yang pasti untuk menurunkan morbiditas atau mortalitas, kematian dan kesakitan. Yang kedua, menjaga supaya masyarakat tetap berfungsi dengan baik, dia sistem sosial di masyarakat. Yang ketiga adalah menurunkan beban ekstra yang dihadapi oleh masyarakat gitu. Ya. Jadi CDC saat ini memberikan rekomendasi, ya kan? Tetapi memang setiap negara bagian itu memiliki aturan atau strateginya masing-masing mengenai siapa yang terlebih dulu akan divaksin. Jadi teman-teman, mungkin kita semua saat ini berada di di tempat tinggal yang berbeda-beda, di state yang berbeda-beda. Saya ada di New Jersey, Mas Bari di New Jersey, Mas Faisal ada di Florida, Mbak Adia di mana Mbak?
Saya di Illinois.
Illinois, lalu ada juga yang di Maryland gitu ya, ada yang di Virginia dan banyak tempat gitu ya. Jadi harus dicek kembali dengan peraturan di negara bagiannya masing-masing. Kebetulan saya dan Mas Bari, karena kami sama-sama berkuliah di Rutgers, the State University of New Jersey, kami sudah mendapatkan email nih dari pihak kampus yang mengatakan bahwa untuk mendapatkan vaksin, kami harus daftar langsung ke sistemnya State of New Jersey. Jadi kita bukan daftar di kampus, tapi kita daftarnya ke New Jersey gitu ya, New Jersey State. Dan di sana kami di list lagi dan distratifikasi lagi berdasarkan profil-profilnya, dan profil-profil kami seperti apakah kami berkaitan dengan bidang medis atau tidak, bekerja dalam fasilitas kesehatan atau tidak, terlibat menjadi frontliner atau tidak gitu ya, lalu apakah kami sehat atau tidak dan sebagainya. Nah, itu baru nanti mereka kan bisa menentukan kita dapatnya di giliran yang mana gitu. Contohnya saya, karena saya baru lulus dan saya sudah dihitung sebagai alumni, maka ketika saya mendaftar untuk vaksin, saya tidak bisa masuk dalam yang fase 1A atau fase 1 atau B gitu. Jadi saya harus bergeser, nanti dapatnya belakangan, dan dianggapnya karena saya usia 18 sampai 55, saya sehat, saya aktif, jadi saya tidak termasuk dalam yang awal. Walaupun selama saya studi di Amerika, saya berada di fasilitas kesehatan. Ya. Jadi CDC membagi yang pertama adalah fase 1A. Itu hanya untuk healthcare personnel dan residents yang berada di fasilitas jangka panjang, itu yang harus mendapatkan duluan. Nah, itu sudah dimulai nih kemarin ya, mungkin dokter-dokter, perawat-perawat, lalu semua yang bertugas di rumah sakit. Gitu ya. Nah, berikutnya siapa? Nah, ini yang dikeluarkan rekomendasi terbaru dari CDC adalah untuk yang mereka yang harus mendapatkan vaksinasi setelah si kelompok healthcare personal tadi. Nah, fase 1B yang kita kenal dengan fase 1B itu adalah frontliner yang esensial. Contohnya polisi, pemadam kebakaran, ya, mereka yang bekerja di pusat pengolahan makanan gitu ya. Lalu mungkin pos, intinya mereka yang mungkin akan mudah sekali terpapar. Atau yang mereka bekerja pada fasos atau fasum, fasilitas sosial ataupun fasilitas umum, yang memang punya potensi terpaparnya tinggi. Dan memang fasilitas tersebut harus segera dibuka. Gitu. Kalau itu nggak dibuka, maka pelayanan atau ekonomi atau mungkin fungsi-fungsi ekonomi itu akan terganggu gitu loh di Amerika. Nah, yang kedua, dari fase 1B ini adalah orang tua, lansia ya. Selama ini lansia belum masuk dalam prioritas untuk bukan prioritas. Lansia masih diragukan gitu. Apakah vaksin ini aman tidak untuk lansia? Karena kita tahu biasanya lansia itu memiliki mungkin penyakit bawaan ya. Ada yang mungkin sudah hidup berpuluh-puluh tahun dengan penyakit tertentu, ada yang mungkin misalnya survivor dari kanker, ada yang mungkin ada penyakit komorbid seperti diabetes atau punya autoimun dan sebagainya. Jadi memang penelitian harus terus dijalankan untuk memastikan bahwa lansia juga termasuk dalam kelompok yang aman untuk diberikan vaksin. Nah, berikutnya ada fase 1C. Jadi kalau tadi fase 1B hanya untuk orang yang di atas usia 75, yang ini sekarang yang mengcover dari 65 sampai 74 tahun dengan resiko sakit yang tinggi gitu. Atau mungkin dia bisa meninggal karena COVID gitu ya. Gitu. Biasanya nih orang-orang tua yang tinggal di mungkin rumah jompo, rumah lansia. Gitu ya. Gitu. Berikutnya juga ada yang usia 16 sampai 64 tahun dengan penyakit bawaan tertentu. Gitu ya. Berikutnya termasuk di dalam fase 1C adalah essential worker lainnya yang tidak tercover dalam fase 1B. Gitu ya. Contohnya mungkin pekerja di bank, ya kan? Energy sektor, communications, orang TV, orang media, gitu ya. Orang yang bekerja di public health atau public safety. Gitu. Nah, minggu lalu saya baca, jadi kebetulan sekali waktu saya dihubungi oleh teman-teman IMSA, saya dapat artikel nih dari The Economist ya. Ini mereka mencoba membuat perhitungan gitu ya. Seberapa lama sih kita harus menunggu vaksin itu bisa mengcover seluruh populasi di seluruh negara gitu ya. Nah, ternyata dari sekian banyak vaksin yang kita tahu dan siap edar, ada yang paling tinggi produksinya di tahun ini diperkirakan adalah AstraZeneca yang dari UK. Menyusul berikutnya adalah Novavax, Pfizer buatan Amerika ada di peringkat ketiga. Pfizer sudah menyelesaikan studi fase 3 dan sudah mendapatkan EUA. Moderna juga sudah menyelesaikan studi fase 3. Hasilnya baru keluar, baru diupdate 2 hari yang lalu, dan saya akan tampilkan data-datanya hari ini untuk kita diskusikan bersama. Yang berikutnya adalah Johnson & Johnson, di mana Johnson & Johnson ini baru selesai fase 1-2A, artinya dia baru menguji pada kelompok tertentu dan dia baru cek efektivitas dan efikasinya, dan dan bulan ini baru akan dilakukan mulai masuk ke studi fase 3. seperti kita ketahui, studi fase 3 adalah studi yang paling berat. Kenapa? Karena syaratnya adalah multi-center dan multi-etnis. Ya, jadi kalau fase 1-2 itu hanya pada suatu kelompok yang homogen, misalnya di US aja, tapi ketika kita bicara masuk fase 3, harus masuk ke multi-center, multi-etnis, multi-ras, gitu ya, karena untuk membuktikan efikasinya dan safety pada populasi yang di luar dari populasi awalnya sendiri. Seperti itu. Nah, kalau yang vaksin yang dilakukan penelitian di Indonesia itu adalah vaksin yang Sinovac Biotech ini. Ya, dan diperkirakan memang ya harusnya sudah bisa menyelesaikan mengcover seluruh populasi di dunia sampai dengan pada akhir tahun 2001. Nah, kalau kita lihat grafik yang di sebelah kiri, ini dapat dari Duke Global Health ya. Jadi si The Economist ini menyadur data dari Duke Global Health. Dia membandingkan garis yang kita ada sebenarnya ini dua grafik dijadikan satu, teman-teman. Ya. Yang bawah itu adalah mengenai jumlah orang yang meninggal per 1 juta orang sampai dengan tanggal 3 Januari. Ya. Jadi memang kita bisa lihat yang mengagetkan buat saya ternyata jumlah orang meninggal di Switzerland tinggi juga ya, gitu ya. Di Switzerland karena memang populasi negaranya kecil. Jadi ketika diambil perbandingan per 1 juta orang, maka jumlahnya dia termasuk yang tinggi. Kalau US, oke, sekitar 55 juta orang per 1 juta yang meninggal. Gitu ya. Saat ini kondisi di US seperti itu. Kalau kita lihat grafik yang sebelah kanan, itu ada angka 0, 100, 200, 300, 400, 500%. Itu maksudnya adalah ketika si negara tersebut membeli vaksin yang sudah di-pool di negara tersebut, itu bisa mencakup berapa persen dari populasi. Nah, contoh ya, itu Kanada yang paling tinggi. Ada di angka 500. Artinya, stok vaksin di Kanada itu sudah mencapai 500%, bisa mengcover 500% dari populasinya mereka. US ada di angka 200%. Jadi kira-kira saat ini di US sampai dengan nanti itu ya tersedia kurang lebih 600 juta dosis vaksin. Kurang lebih. Di grafik ini kita bisa belajar hal tersebut. Berikutnya, yang sebelah kanan, ini kita bicara rollout. Berdasarkan stratifikasi dari kemampuan atau income negara. Gitu ya. Perencanaan rollout-nya kurang lebih akan seperti ini. Nah, sekarang kita ada di US, masuk ke dalam kategori richer countries with priority supply details and or small population. Ya, teman-teman bisa lihat di sini gambarannya bahwa US memulai dengan approval dari regulatory, dia masuk dilanjutkan dengan priority groups. Priority groups-nya adalah yang tadi health personnel dan sebagainya, lalu mungkin orang tua ya, fase A1, A dan B, lalu masuk ke dalam kelompok rentan lain bersamaan dengan biasanya ada negara-negara tertentu yang mungkin bermain di medical tourism gitu ya. Nah, itu juga mereka sejalan tuh. Baru sisanya rest of the population. Nah, makanya The Economist memperkirakan bahwa rollout vaksin ini baru akan selesai setelah tahun 2023. Kalau untuk negara yang kita kategorikan negara high income countries, dia bisa menyelesaikan rollout vaksin ini mungkin kira-kira bisa paling cepat 2021, paling lambat 2022. Tapi bagi negara yang dianggap negara yang miskin, paling cepat dia bisa masuk ke dalam menyelesaikan vaksin ini sampai mungkin kira-kira paling cepat adalah 2023. Kalau kita bicara Indonesia, ya ini sekedar untuk meningkatkan awareness teman-teman saja. Saya tidak tampilkan di sini karena saya sebenarnya agak sedih ngelihat map yang dibuat oleh jurnal di The Economist ini, bahwa kita dianggap baru bisa selesai setelah tahun 2023. Bukan berarti kita masuk ke dalam kategori low income countries, tetapi karena memang populasi dan letak geografis kita yang terlalu rumit ya untuk bisa dijangkau oleh vaksin sebetulnya. Bagaimana caranya vaksin dengan chain vaksin yang ada storage dan sebagainya di-deliver dari Jakarta sampai ke pelosok yang ada di gunung-gunung dan hutan-hutan gitu ya. Itu jadi tantangan tersendiri buat kita semua. Jadi teman-teman harus ikut bantu memikirkan dan mengawal supaya negara kita juga, selain kita memikirkan diri kita sendiri, kita juga bisa memberikan sesuatu buat negara kita. Oke, sekarang ini masuk dalam yang buat saya paling menarik karena sebagai mahasiswa yang lulus dari program clinical trial, ini udah makanan sehari-hari saya, tetapi yang sulit adalah bagaimana membuat teman-teman yang masih mempertanyakan efficacy dan safety dari vaksin itu memahami, kita bisa membaca jurnal-jurnal ini dengan baik gitu ya. Prinsipnya teman-teman, yang kalau kita melakukan clinical trial itu sebenarnya cuma 2 yang diperiksa, antara safety atau efficacy-nya. Safety bicara masalah keamanan, jadi kita bicara efek sampingnya apa? Ada efek samping yang sifatnya lokal, ada efek samping yang sifatnya sistemik. Sistemik itu artinya yang dirasakan di seluruh tubuh, misalnya demam, ya, atau merah-merah tapi seluruh badan, misalnya, atau muntah-muntah, atau diare. Pokoknya segala sesuatu gejala yang muncul tapi direspon oleh lebih dari satu organ tubuh, gitu ya. Kalau kita bicara efek samping lokal, maka itu hanya dirasakan atau direspon oleh bagian tubuh tertentu saja. Contoh, ketika kita disuntik, suntiknya kan di tangan. Efek samping lokalnya terjadinya di tangan. Misalnya, bengkak di tangan, di tempat penyuntikan. Misalnya, merah di tempat penyuntikan, atau rasa nyeri dan pegal-pegal. Itu adalah di tempat penyuntikan. Tetapi kalau dibilang pegal-pegal atau myalgia, dirasakan di seluruh tubuh, itu efek samping sistemik namanya. Kalau kita bicara efficacy, artinya seberapa efektif sih vaksin dan atau misalnya obat tertentu bisa mengobati atau memprevent sebuah penyakit. Dalam hal vaksin, maka efekasinya adalah berapa persen jumlah COVID ini bisa ditekan dengan pemberian vaksin. Sekali lagi ya, saya ulang. Efekasi pada trial vaksin adalah berapa persen kejadian COVID-19 bisa ditekan dengan adanya pemberian vaksin. Nah, kita review. Ada 3 yang dibuat di US karena ini adalah teman-teman di IMSA dan Permias. Jadi saya menekankan 3 vaksin yang ada, Pfizer, Moderna, dan Johnson & Johnson.
Dr. Alvin, maaf menginterupsi, mau mengingatkan waktunya tinggal 3 menit lagi.
Wow, oke, kita selesaikan. Grafik ini hanya menggambarkan bahwa yang pertama adalah Pfizer. Pfizer itu dilakukan pada merupakan sudah menyelesaikan studi fase 3 dan datanya sudah rampung dari sejak bulan Desember 2020. Dan bisa dilihat, dia lakukan studi pada kelompok berusia 16-55 dan kelompok berusia lebih dari 55 tahun. Yang 16-55, teman-teman bisa lihat, itu kejadiannya, ini efek samping lokal, pain at injection site, redness, dan swelling, semuanya rendah. Rata-rata hanya terjadi reaksinya ringan saja. Oke. Berikutnya adalah yang efek sistemik. Teman-teman bisa lihat, itu nama efek samping sistemiknya ada di bawah, dan semuanya rata-rata rendah. Warna hijau artinya mild, warna biru artinya moderate, warna kuning artinya severe. Tapi prinsipnya tidak ada yang menyebabkan kematian. Grade 4 atau efek samping grade 4 itu tidak ada di sini. Bahkan tidak banyak pasien yang membutuhkan obat antipiretik atau anti demam. Bisa dilihat yang grafik paling kanan. Oke. Berikutnya ini juga efek samping tapi pada kelompok yang usia lansia di atas 55 tahun. Sama, trennya rendah sekali dan tidak banyak orang membutuhkan obat penurun panas, obat demam pada saat akhir penyuntikan. Yang grafik atas adalah pada saat penyuntikan pertama, lalu diselang 2 minggu dilakukan penyuntikan kedua. Tidak terlalu banyak orang yang membutuhkan obat anti demam. Berikutnya, kita bisa lihat efikasinya. Teman-teman langsung lihat, kalau kita bicara efikasi, lihat endpoint-nya. Ya. Yang pertama adalah adanya COVID-19 pada kejadian COVID-19 pada 7 hari setelah penyuntikan dosis kedua. Yang keduanya adalah at least dalam 7 hari pada penyuntikan kedua. Ternyata jumlahnya sangat kecil yang mengalami COVID-19 dari jumlah yang disuntikan dibandingkan dengan yang diberikan placebo. Bisa dilihat, efikasinya mencapai 95%. Nah, ini adalah sebuah contoh bagaimana kita menyangkal hoax. Gitu ya. Dia membagi lagi pada kelompok-kelompok usia tertentu, berapa sih efikasi vaksinnya? Kalau mau lihat, saya ambil contoh, age group kita 16-55, vaksin efikasinya 95,6%. Langsung lihat ke yang bagian vaksin efikasinya. Ya, gitu. Pada ras tertentu, kita masuk dalam Asian, ya kita masuk di all others, berarti di sini 89,3%. Gitu. Ya, berikutnya adalah Moderna. Sama, ini juga efek sampingnya cukup rendah. Ini adalah grafik yang tadi tabel, kalau di Pfizer tampilan tabel, kalau di Moderna tampilannya grafik gitu. Tapi ini menggambarkan juga bahwa ya, jumlah efikasinya adalah 93%. Oke, dikit lagi ya waktu saya. Ini kalau analisis subgroup. Intinya teman-teman bisa lihat targetnya efikasi itu maunya target idealnya adalah pengennya 100%. Nah, membacanya adalah semakin grafik ini menjauh ke kiri dari garis putus-putus ini artinya semakin rendah efikasinya. Tetapi serendah-rendahnya vaksin, serendah-rendahnya efikasi pada hasil penelitian ini, lihat tidak ada yang di bawah 80%, semuanya dekat-dekat sama yang titik-titik ini. Berikutnya ada J&J. Nah, ini yang paling menarik. J&J, kalau yang Moderna itu adalah data terbaru teman-teman tadi, yang tadi saya tampilin, itu data 2 hari yang lalu baru diupdate di NIJM. J&J baru keluarin data tanggal 14 Januari kalau saya nggak salah. Mungkin ada yang sudah update, ada yang belum update, tapi intinya sama. Kalaupun ada efek samping, teman-teman bisa lihat, itu rendah teman-teman efek sampingnya. Semua ada di dalam grade 1 saja. Grade 2 yang warna biru, grade 3 yang warna orange, tapi jumlahnya sangat rendah. Gitu. Nah, perlu diketahui J&J membagi peserta subjek penelitian itu dalam beberapa cohort yang dianalisis pada penelitian ini adalah cohort 1 dan cohort 3. Ini namanya interim result. Interim result adalah analisis hasil yang dilakukan di tengah-tengah masa penelitian ketika data dirasa sudah cukup, tapi durasi penelitiannya masih belum selesai. Kenapa dilakukan interim analysis? Karena mereka butuh untuk masuk, karena kebutuhan vaksin ini mereka harus segera lari ke fase 3. Gitu. Cohort yang diambil dalam studi ini adalah yang usia 18-55 dan usia di atas 55 tahun. Oke, ini yang tadi adalah yang systemic symptom, lalu ada local symptom, yang ini adalah yang pada usia di atas 55 tahun. Sorry, yang tadi usia di bawah 55, yang ini di atas 55. Nah, ini yang menarik. Jadi tadi mungkin Dr. Azabi sudah menjelaskan bahwa yang dirangsang adalah imunitas atau antibodi. Dan respon antibodi dalam tubuh itu ada 2 macam. Ada yang humoral dalam bentuk protein atau yang kita sebut dengan antibodi. Ada juga imunitas yang disebut imunitas seluler yang tadi disebut dengan sel T, sel T dan sel T helper, right? Sel T dan sebagainya dan teman-temannya. Nah, ini adalah efek yang imunitas humoralnya. Teman-teman bisa lihat setelah penyuntikan kedua. Jadi ada garis panah nih, garis panah yang pertama dan garis panah yang kedua, gitu ya. Mereka yang disuntik menggunakan, lihat yang ini, yang saya poin, itu jumlah proteinnya meningkat berkali-kali lipat. Ini penyuntikan hari pertama, pada penyuntikan kedua kali sudah naik tinggi. Ya, dan di hari ke-71 dia bisa meningkat. Artinya vaksin Johnson & Johnson itu bisa memberikan pertahanan sampai dengan hari ke optimalnya itu menaik sampai di hari ke-71 pasca penyuntikan pertama. Gitu. Ini adalah proteinnya. Ini yang atas adalah protein, yang bawah adalah virus neutralization. Tersama, mereka juga bisa memberikan neutralisasi virus sampai dengan hari ke bisa memberikan neutralisasi virus yang lebih tinggi pada saat penyuntikan kedua. Gitu. Nah, berikutnya adalah imunitas yang sifatnya seluler. Seluler ini biasa tadi penyuntikan pertama dan penyuntikan kedua, dan bisa dilihat responnya. Yang atas adalah CD4 T cells yang dilakukan pada kelompok yang sebelah kiri yang background-nya putih itu adalah kelompok usia 18-55, yang sebelah kanan yang warna biru itu adalah kelompok yang di atas usia 65 tahun. Nah, sama penyuntikan di hari pertama dan di hari ke-15, jadi di selang 2 minggu gitu ya. Teman-teman bisa bedakan pada kelompok yang dua-duanya disuntik placebo, dua-duanya disuntik low dose, yang dua-duanya disuntik high dose. Ternyata yang disuntik pada pasien yang diberikan pada subjek trial yang diberikan penyuntikan dosis rendah dan dosis maupun dosis tinggi itu memberikan peningkatan imun respons seluler, jumlah sel CD4T-nya meningkat. Sama, kalau ternyata dia tidak mempengaruhi sel CD T helper 2, tetapi pada kelompok CD8, T sel CD8 terjadi peningkatan respon imun seluler setelah dilakukan penyuntikan vaksin. Bisa dilihat ya, ini garisnya di baseline yang saya tunjuk. Yang sebelah kanan terjadi peningkatan respon imun kurang lebih hampir 2-3 kali lipat. Baik yang disuntik dengan dosis rendah maupun dengan dosis tinggi, nggak beda. Gitu ya. Sekarang kita masuk ke dalam apa sih yang mempengaruhi rollout di universitas. Seperti tadi saya bilang, di universitas tergantung. Ada state policy, ada university policy. CDC mengeluarkan guideline, tapi setiap state itu memiliki strateginya masing-masing. Kalau di universitas juga, ada yang malah universitasnya tidak memberikan penyuntikan, tetapi dia bilang mereka menginduk kepada rencana yang dikeluarkan oleh state. Jadi, teman-teman harus baca lagi ketentuan yang dikeluarkan oleh state masing-masing. Dan juga stick pada ketentuan dikeluarkan oleh universitas masing-masing. Mbak Adia, contohnya di Illinois, sebagai public health student, itu sudah mendapatkan duluan. Kenapa? Karena sebagai university student, dia termasuk dalam kelompok yang medical related. Gitu. Terakhir, dari saya adalah kampanye dan bagaimana kita mengkomunikasikan. Pertama, selalu look to evidence. Baca evidence dengan baik, kemampuan untuk membaca jurnal, tabel, data, itu sangat penting. Berdiskusi dengan ahli, dan terakhir, sebelum kita menyebarkan informasi, harus dianalisis dulu benar atau salahnya, dan harus awas dengan informasi yang mungkin bisa bersifat misleading atau salah yang kita sebut dengan hoax. Jadi harus hati-hati sekali dalam menyebarkan informasi. Saya rasa itu saja yang bisa saya share hari ini. Lebih kurangnya saya mohon maaf. Terima kasih atas kesempatannya teman-teman dari IMSA Student. Wassalamualaikum warahmatullahi wabarakatuh. Selamat pagi.
Terima kasih banyak Dr. Alvin. Tadi sudah memaparkan banyak sekali informasi, tentunya terkait rekomendasi CDC mengenai rollout Covid-19 vaksin. Kemudian juga tadi yang penting adalah bahwa teman-teman bisa memastikan kebijakan dari state-nya masing-masing, dan juga mungkin bisa bertanya gitu ya ke kampus, kemudian juga ke state untuk memastikan bagaimana rollout vaksin di state masing-masing gitu. Juga tadi Dr. Alvin banyak menjelaskan begitu ya mengenai rollout dari masing-masing vaksin gitu ya. Yang sangat menarik juga adalah bahwa untuk negara-negara dengan income tinggi, kemudian kemungkinan akan menyelesaikan vaksin ini dalam waktu 1-2 tahun. Dan untuk low middle income country gitu ya, paling cepat adalah di tahun 2023 gitu. Dan juga tadi Dr. Alvin menjelaskan mengenai bagaimana gitu ya kita sebagai seorang yang terpelajar gitu ya, kita juga perlu menyampaikan informasi kepada masyarakat, tapi kita terlebih dahulu mengedukasi diri kita sendiri gitu. Jadi kita bisa membedakan mana yang faktual, mana yang hoax gitu ya. Itu penting sekali menurut saya. Nah, kemudian kita sudah punya banyak sekali pertanyaan dari teman-teman di sini melalui chat, dan juga teman-teman yang menonton melalui Facebook dan YouTube bisa memberikan pertanyaan juga lewat komen gitu ya. Nah, ada beberapa pertanyaan juga yang sudah dijawab oleh Dr. Azaibi melalui chat, dan saya akan membacakan mungkin yang belum terjawab terlebih dahulu. Begitu. Yang pertama dari Ibu Merina Hutabara, kemungkinan ini pertanyaannya untuk Dr. Alvin ya. Apakah ada kemungkinan permohonan permintaan vaksin ditolak due to health background? Mungkin bisa dijawab terlebih dahulu.
Dari apa, sorry?
Alvin. Apakah ada kemungkinan permohonan permintaan vaksin ditolak due to health background? Jadi mungkin ada pre-existing condition yang membuat seseorang ditolak untuk menerima vaksin.
Ya, sekali lagi permasalahannya bukan pada kondisi penyakitnya, ya, health background, oke. Bukan pada penyakitnya, tetapi adalah pada datanya. Sudah ada data atau belum cukup data? Kalau sudah cukup data, maka sangat mudah sekali untuk memberikan approval pada kelompok-kelompok vulnerable tertentu, misalnya pada penyandang penyakit autoimun. Kita masih belum tahu apakah vaksin itu ketika disuntikan akan merangsang reaksi imunitas yang berlebihan sampai misalnya menyebabkan efek samping grade 3 atau grade 4 yang mungkin bisa menyebabkan kematian akibat menyuntikan vaksin atau tidak. Jadi sekali lagi yang diperlukan adalah kecukupan data. I'm actually highlighting on the availability of the data. We cannot speak or we cannot decide something before we have the data set and the right analysis of the data. Gitu. Pada kelompok penyakit tertentu, I think we need to have we can try to do the interim analysis of the data. Karena memang kebutuhan. It's all about the needs, you know. It's all about the demand that we need to give the vaccine as soon as possible. Tapi kalau belum ada data, kita mau gimana? Sekali lagi itu jawabannya. Terima kasih.
Ya, terima kasih Dr. Alvin. Semoga menjawab pertanyaannya ya. Selanjutnya saya akan membacakan pertanyaan lagi. Ya, ini terkait pertanyaan untuk Dr. Azaibi. Saya harus scroll sebentar. Cukup banyak ya pertanyaan dari teman-teman. Ya. Ya, ada pertanyaan terkait efektivitas vaksin ya. Banyak berita beredar dari pertanyaan dari Pak Syafrin. Banyak berita beredar setelah vaksin, tapi tetap terkena infeksi COVID. Sudah mengikuti berita dengan beberapa teori, mengapa itu tetap terjadi? This is the question for Dr. Azaibi, and Dr. Azaibi already answered the question. That we must see the evidence of reinfection post-vaccine. It's not impossible, but it's not impossible, but actually expected to minority vaccines, but less severity of the illness. Mungkin maybe Dr. Azaibi wants to explain more about this.
Alhamdulillah. Thank you for the question. The vaccine, just like any drugs or medicine, is not absolute. Science or medicine by nature are not absolute. It's not black and white. For example, the data of, like, say, Moderna or Pfizer vaccine is 95% or above 90%. This is excellent, never heard of in the vaccine before. That means if you have 95%, that means 5%, if 100 people, 5 people are sick. It has, in other words, sick means it got infected. But usually when vaccinated people, they are infected, it's a very rare by minority, but usually the illness is less than natural infection in any vaccine, because the objective of the vaccine, they are great. The top objective for vaccine is to protect infection and illness. Protection, infection, or illness. They're two different things, because infection, not everybody is have a clinical illness. For example, and the only way you can know people are infected and they're asymptomatic is by testing it. But illness, you have a clinical symptom. So therefore, to know we studied this not in vaccine, in nursing home. Many people, like a healthy grandma and grandfather, have tons of viruses, but they are happy and good looking. But they have viruses, and this virus can infect other people. And we published that in the New England Journal of Medicine, I think. Now, so vaccine is normally, if you are vaccinated, if you are protected, the second objective is not from illness. You're protected not from infection, but from illness. But there are certain rare occasions, because of your genetic background and what have you, Allah knows best, that certain vaccine, certain people, the vaccine just doesn't work. I have a friend, a scientist, work with the MMR. Her vaccine cannot turn on her mom's antibody. two different vaccine. It's not, in the jargon of vaccination, call it seroconverted. Some people, minority cases, they're not seroconverted. They cannot make antibody against that particular vaccine. However, usually their T cell is good. If you have two options, right? Two options, what we discussed, like B cell and T cell. If you have an option, the easy way to measure vaccine by B cell, by antibody, is I do this. This is quite easy. However, to test T cell response is more complicated. But usually people, the problem is when the people are not responding to B cell and T cell. This is problematic. But some people, they're not sort of converted. The B cell doesn't work, but the T cell work. That's why there are certain illness, for example, the genetic illness, that people cannot make antibody. But they are safe from measles, for example. Why? Because the T cell is functioning. This is so don't worry. Majority of vaccine is protected from infection and also illness, but great majority will be protected against the illness. I hope that answers the question.
Thank you, Dr. Azaibi. I think that's the important thing that we have to know, that you mentioned about the vaccine. That vaccine will not 100% protect us from the infection, but the vaccine can make the illness less severe. And I think it's important di masa-masa sekarang ini, ketika banyak tenaga kesehatan yang sudah kewalahan gitu ya. Tentunya dengan adanya vaksin ini sangat membantu. Banyak yang sudah tervaksin untuk tidak mengalami gejala yang lebih berat gitu, sehingga mengurangi tingkat hospitalisasi. Kemudian I think there's a follow-up question from Robbie. Why other or previous vaccines never reach such a high efficacy rate? Is it simply a matter of technological development, so we can expect many future vaccines to also have similarly high efficacy rate? This is the question for Dr. Azaibi.
That's a good question. The honest answer is we don't know yet, but I can speculate the reason why the mRNA vaccine work better. Now, imagine, as I show you the list of vaccine that are mRNA, they are protein, they are recombinant, they are in kill vaccine, right? The last four, like Chinese, 3 Chinese, and an Indian. These are inactivated vaccine. Except mRNA and recombinant adenovirus, right? So the protein vaccine, let's say do the protein and the inactive vaccine. If it enter the cell, when inject to your body look your antigen presenting cell or phagocyte, macrophage, all this cell will recognize this is a protein made by manufacturer, not by the body. Remember, the protein is made by the manufacturer and whatever system they have, not by your body. Now, there is a very interesting process. We have like more than 200 type of cells in our body. 200 type of cells. I'll give you just the concept. Let's say the eye or retina of the cell, a cell in the retina, and my skin cell have the same genome. This, you have to understand this. Have the same genome. But the issue is the protein in the eye is switched on for the eye, but the skin or for the skin is switched on for the protein necessary for the skin. That's why skin cell becomes skin. The eye retina cell become retina, not skin, right? So this switch on, switch off. What I try to make understand is each cell process the genetic expression of the protein it wants by itself. And the protein and the cell in our body recognize better if it produces certain way. So now you take mRNA vaccine from Pfizer or Moderna, right? Go to my cell. Let's say antigen, let's say a macrophage, take that cell. It's sucking into it, and then it had to be translated into protein. The mRNA is not a vaccine. The macrophage or the cell have to express it to translate it into a protein of S, right? Now, the S protein had two ways to go to outside world. One is they're going to go straight away to the membrane to make that S protein, unlike the virus, they call it full protein. This is important for the B cell. Now, the other part of pathway is the cell will chew up into pieces of the cell into fragments. And then that thing will connect with the MHC protein. Another protein on the membrane outside, it had to sit by fragment. And that's important for T cell. So B cell and T cell look from a different geographical map, if you will, of the protein. Now, from your translated protein inside the cell to become MHC associated or to become on the surface, each cell do different way, are very specific. So the mRNA is a good vaccine, I think, because our body make the protein according to what it likes. So the B cell and the T cell will look at it what they like. Because we make our vaccine. The vaccine is not from outside. Our body have to make it. So it fits the way they look at it. And that's the thing, my speculation, but it's biology. Biology is complex, and the explanation of one person to another person is different. And this is actually another a nice field of research to understand the mechanism why the mRNA vaccine is better. But I think that's something to do with passive and active, because mRNA requires active participant of our body, whereas protein vaccine is passive. You know, like basically like people, you go to a restaurant, you order food, right? You say, okay, give me bakso, soto. So the patient, the server will give you, the restaurant will prepare you your bakso, right? Okay, he said, now, let's say the restaurant say, Dr. Azabi, you can order your own recipe of bakso. Then I said, okay, I want this, my bakso for my grandma. Make this. I got it. I love my grandma bakso. Because why? I have a choice. I know what I like. The same thing with our body. Our body make the S protein actively. So it make according to our body. Whereas the protein, the vaccine protein, like a protein or inactive with the virus, our body passive. It's just like it's already made. That's why I think the participation is not that excited. You need excitement for the cell to induce more. Allah.
Yeah, thank you so much, Dr. Azaibi. Yeah, I think that's the microbiology thing is kind of difficult thing to understand for everyone that doesn't have any background with it. But thank you for giving the illustration with the restaurant thing and with the menu that can be related with the vaccine in our body. Next selanjutnya mungkin saya akan berikan pertanyaan untuk Dr. Alvin. Di sini juga sudah banyak pertanyaan dari teman-teman. Yang pertama, mungkin saya akan berikan sekaligus 2 pertanyaan ya. Yang pertama tadi terkait kira-kira kapan international student bisa mendapatkan vaksin. Kemudian pertanyaan dari Robi, ada argumen supaya setelah kelompok kritis dan prioritas tervaksinasi di high income countries, vaksin yang tersedia selayaknya diberikan dulu ke kelompok kritis dan prioritas di negara low and in middle income sebelum diberikan ke populasi healthy adults di negara-negara high income. So what is the public health perspective on this? Yeah.
Okay, it's a tough question from Robbie. I'd like to answer the first one from Pateo first. So as I typed there in the chat box, kebijakannya sekarang, the policy is not about to differentiate between US citizen and non-US citizen. It's about to vaccine the populations who reside in the US. So it's all so vaccine is available for all residents. including the international students studying in the United States. That's why the international students in the US, ya, mahasiswa internasional itu bisa mendapatkan vaksin di waktu yang bersamaan dengan populasi atau warga negara AS itu sendiri. Jadi, but the point is when, ya, silakan tunggu penjadwalan. So you have to make an appointment, make the registration, fill in the data, and wait for their confirmation email. Gitu. Berikutnya, pertanyaannya dari Mas Robi about the public health perspective. Well, since public health is not my expertise, I'd like to try to answer this in a very simple way, that to distribute vaccine to countries it's actually comprises of a lot of factors. It is influenced by a lot of factors, not to mention economical power, number of populations, and sometimes it's also about geopolitical negotiation. We can control, the geopolitical negotiations, we cannot control that. It's actually between the countries that negotiate one another, So it's very difficult to answer, but you have to consider that this is not only just a simple health problem, because when you try to work on this matter and to involve, when this COVID-19 problem has involved and caused multidimensional problem, then a lot of disciplines, a lot of sectors will take in part, and those things can be interfering one another. So in short, not all countries can provide the vaccine, can distribute the vaccine to the people in a very short time. Kalau kita bicara dari sisi humanismenya, memang harusnya berbagi, ya. We have to share. But again, it's not about how to share between countries. It's about how every country protect their own people. That's the idea of this, this premise, actually. Yeah, I think that's all that I can say.
Ya, terima kasih Dr. Alvin. Saya rasa itu meskipun simple ya kata Dr. Alvin jawabannya, tapi menurut saya itu sangat menjawab sih, karena ya meskipun public health perspektif itu menjunjung justice begitu ya, kesehatan untuk semuanya, tapi lagi-lagi ini adalah masalah politik begitu ya, politik will dari masing-masing negara punya ideologi gitu, bahwa untuk menyelamatkan gitu ya, mensejahterakan their own people first gitu. Biasanya seperti itu. Jadi ya ini
Mbak Ade yang lebih cocok menjawab sebenarnya, Mbak, sebagai orang public health.
Ya, ya mungkin jawabannya sama seperti Dr. Alvin sih. Seperti itu sudah sangat menjelaskan begitu gambarannya. Saya hanya menambahkan sedikit aja.
Saya tambahkan sedikit. Kalau tadi lihat di presentasi saya, yang grafik kita bisa lihat ada beberapa negara yang mungkin sudah ijon duluan. Teman-teman, nyebutnya, kita sebutnya ijon. Saya ingat bulan lalu saya ada webinar bersama dengan Pak Menkes yang baru, dan beliau di situ memaparkan bahwa, webinarnya terbuka untuk publik gitu ya, dia memaparkan bahwa ya sudah diijonkan oleh beberapa negara. Contohnya Kanada bisa sampai save untuk 500% dari populasi mereka. Padahal mungkin populasi mereka berapa sih? 30-35 juta, tapi mereka sudah menyimpan sekitar 150 juta dosis vaksin di negara mereka sendiri. Seperti itu. Jadi ya itu sangat tergantung signature dengan negaranya masing-masing. Thank you.
Ya, baik, terima kasih Dr. Alvin. So there's another question for Dr. Azaibi. This is the question from Parus Dianto from Facebook. Do we know how long the vaccine lasts? Do we need to get vaccinated every year like the flu vaccine?
That's a good question, alhamdulillah. And however, there are many factors. Vaccine is a medical science, so we have to wait for the long-term data to know how to survive. However, if we can gauge preliminary data, because we studied the first group of US patients and follow their natural history, at least by 6 months, they still have antibody response. So at least we know for 6 months, it still survive the vaccine response. Now, the question is whether we need an annual vaccine. It depends on how the virus behave. Now, the good example model of changing that you have to do vaccine every year is the flu. The reason is the flu is the genetics of the flu, because segmented is easy to be swapped. It's not just mutation, it is swapping. So they're changing so much. That's why they have a new vaccine every single year. So if the variants, for example, like I'm one of my core responsibility at CDC is to track the vaccine variant all over the world. So we test everything that come in, so that the moment that, let's say, we know the vaccine work, let's say 95%, and we know exactly how much antibody respond and how many T cell respond, right? Let's say another 1 year, at the end of this year, we get another variant, and we tested the efficacy in neutralization, because one of the most important part of the vaccine to neutralize infection. Let's say compared to the original virus, to the new virus, it has only 50% neutralization capacity, right? Then if that keep on going, then there's a potential you have to need a new vaccine. But actually, as we speak, I think Moderna as well as Pfizer, they only tweak some of the vaccine they have according to the UK variant, the changing. And one of the luxury of mRNA technology is produced in synthetic, in machine. So you can design, you change amino acid, the gene is very easily changed, the RNA, I mean. So if the variant goes so crazy, maybe not every year, maybe it's like every 3 years, every 2 years, then you have you require the new vaccine. So depending on the interaction of between the virus and the human population. And what usually happen is that one of the challenges virus behavior is this virus can infect animals. Between human to human, there might not be too many changes, but the problem, let's say a mink, like there is a report in European group, for example, like if the virus go from human to mink or to the animals, and the animal back to human, because the animal have different system, the cell are different, so they might change. And one of the challenge, Allah created this RNA virus like SARS. It doesn't have editing function. Editing function means when it make mistake, it cannot correct it. Can you imagine if your computer, your Word file document, there's no editing function. So you had a lot of mistake. People will see your mistake, your grammar, your spelling, and everything. So RNA virus Allah created doesn't have that editing function. That's why it make more mistake. So yeah, if there is down the road, if there are changes, and we have a new vaccine, but alhamdulillah, because the new technology, it's easy to change that. However, this is one of the messages that I like to stress. Whether the vaccine is good or not, accepted or not to be used, whether I need to take the vaccine or not, it's not technology. Technology is easy to understand, that's secondary. The final test is the clinical trial results. Clinical trial. So look at the result of the clinical trial. If the vaccine manufacturer doesn't give me the result, doesn't explain to me by the third party, not by the manufacturer, by the third party. That's what the US and Europeans do. The third party interpretation of the data of the clinical trial. Then I'm not going to take the vaccine. Unless it's emergency, right? I mean, death or life, I will take it. But if normal circumstances, no, I'm not going to take the vaccine. Because Islam demands knowledge and verification. Verification is Islamic and scientific. So that is very important. And people sometimes in a chat, in the mass media say they worry, I'm not going to take this vaccine because it's just so, like less than 1 year you could make a vaccine. Usually the vaccine takes many years. This is intellectual trap, intellectual smartness, but doesn't understand the knowledge of science of vaccine. The truth of the matter is, as I said, the most critical part of the vaccine, whether you accept it or not, it depends on a clinical trial result. The clinical trial of any vaccine in the last century, in the 1990s, until today, is the same way, is the same time. That the frame of the trial is the same. And actually, this vaccine of COVID-19 has tested more number of people than any other vaccine in the history. So there you go. So you measure on the clinical trial, not on the time, because the time is because of the money, the technology, and so mostly about money, because usually part of the problem to make a vaccine is the money. The company need money to do this. But because of this pandemic, the government like dump in like a couple of $1 billion to Moderna. That's unheard of, right? So with the money and with expertise, with the technology, everything come into this in the pot and make it happen. And I like to address some of the problem facing that another question like inequality. Some poor country, mostly Muslim country, doesn't have a vaccine. The solution is, I hope the leaders of the Muslim world wake up. Wake up. So we have scientists, we have PhDs in Muslim country, and over here can make this vaccine, mRNA vaccine. And all vaccine is not so complicated. It can be made by the Muslim country, right? So the lesson here is, I'm waiting, hopefully in my lifetime, there will be a certain institution in Muslim country, and Muslim country have money, some of them. And what happen if institute, Wakaf, like a Wakaf, make the vaccine scientifically, state of the art, publish it, share the data, and give to the poor country for free. That is Amal Jariyah. That is the best, one of the best da'wah for Islam, right? But unfortunately, the Muslim country politics are so much embroiled in the problem here in their hearts. So at the end of the day, it's our problem in our heart. This is the problem as individual as well as politician or somewhere in between. I'm not blaming the politician, because I have been the diseases of the heart myself too. So we can do this as community, and we have the money and we have the brain. We just don't have the institution to do this. And I think the stress of Islam is to teach humanity to build institution. Look at Ottoman. The Ottoman Empire is the only empire can survive for 700 years in Asia and Europe, right? But what are our young people interested in to go into politics or Islamic politics? They go to Medina time. This is a problem. We want to reinvent the wheel. So we have to look at the problem and asking, where are we? Where are we going? What are we going to do with it? And we have the brain and the money and the guidance. We have the Quran and Sunnah to guide us better than what the West and the East can provide. But it takes our heart to re-examine our heart as individual, as a citizen, husband, wife, children, and the political leaders. And we have to admit, it starts with the family, it starts with the individual, right? So that's my excitement of that. This people think that mRNA vaccine is so high technology. No, we can do this. We can buy the machine. We have the engineers, right? So the thing, we have no willpower. We are bickering with each other. And at the end of the day, I have to admit myself, the reason why Muslim country doesn't have this vaccine, this is an example Allah show us, because collectively, my salah and the salah of a Muslim collectively still not effective. Our ibadah not effective, right? And this is the thing that we have to admit. We have to work on our salah, we have to work on the fiber of Islam, and then share the fruits of that pillars of Islam. And one of them is make a vaccine, make a medicine, give food to everybody. We have the capacity to do that. Indonesia, for example, you have thousands of islands, so many forests, so many brain. You can make an airplane. Yeah, you can make an airplane. Not many Muslim countries can make an airplane. You have the brain. Look how many PhD in the out of the Bapak Habibie program end up in United States. United States has this PhD. But just like in here now, we can collaborate by Zoom, virtually collaborate. We make vaccine, cure diseases, but the most important disease we have to cure is not COVID-19, it's a disease of the heart. That message, that's advice for myself, first and foremost, and to you all. We have to get rid of the disease of the heart. Make it primary important. Then the disease of the illness of the physical body, secondary. Wallahu alam.
Ya, Masya Allah, Jazakallah khair, Dr. Azaibi. Thanks for reminding us that we are as individuals also has responsibility to build a healthier population, right? Especially during this pandemic. This is because that we are the part of our community. Ya, jadi karena kita mempunyai waktu yang terbatas dan I think we already covered most of the questions. Saya persilahkan untuk each speaker to give the closing remarks, maybe 1 minute. First from Dr. Alvin.
Ya, baik. Terima kasih sekali lagi saya ucapkan kepada seluruh panitia, teman-teman IMSA, dan Dr. Azaibi juga yang telah sharing. Prinsipnya kalau dari saya, yang terpenting adalah untuk roll out vaksin di US tidak perlu khawatir bagi mahasiswa internasional karena kita bisa mendapatkan vaksin yang secara bersamaan dengan US resident lainnya dan juga untuk mencegah penyebaran virus hoax ya, virus hoax dan mungkin informasi yang misleading. Bagi yang terpenting adalah tetap harus kembali kepada evidence-nya. Evidence base-nya ada di mana? We have to be evidence based lah sebagai kaum akademisi yang terpelajar biasakan untuk banyak mencari informasi di jurnal dan artikel-artikel ilmiah sebelum dan apabila kita mungkin tidak begitu memahami karena memang jurnal tersebut bukan bidang kita, mohon berkonsultasi terlebih dahulu kepada orang yang memang setiap sehari-harinya membaca dan memahami atau mendalami bidang jurnal tersebut. Untuk vaksin ini saya yakin teman-teman yang kuliah medical science ataupun public health bisa membaca jurnal. Jadi silahkan merujuk kepada teman-teman yang kuliah di public health atau cari public health specialist untuk menjelaskan sebelum Anda menjelaskan atau mencoba menyebarkan informasi kepada orang lain. Dan pastikan bahwa informasi yang Anda terima itu sudah diperiksa kebenarannya dan bukan berita yang salah. Saya rasa itu saja. Semoga kita tetap sehat selalu. Insya Allah tahun ini mungkin kita semua sudah bisa divaksin semuanya, ya. Jadi menghindari efek atau gejala yang berlebihan apabila satu hari nanti kita, ya amit-amit ya, kena COVID gitu ya. Tapi at least memberikan pertahanan sebagai bentuk ikhtiar bagi diri sendiri maupun orang lain. Itu saja. Sekali lagi selamat siang. Wassalamualaikum warahmatullahi wabarakatuh.
Terima kasih banyak Dr. Alvin. Selanjutnya closing remarks from Dr. Azaibi, and maybe you can also touch about the discussion today, the conversation today about why all COVID-19 vaccine currently available are considered halal. There's also a question from Facebook. Yeah.
Alhamdulillah. The question, this is the problem with the Muslim today. We are concerned with halal or not halal. It's a good question, but the way they frame it is very is not useful. If I ask a scholar, I'm tanya ulama, right? I said to him, or to her, I said, yeah, Sheikha, what is the ruling of using the vaccine of the one that we have available today? If the scholar is a smart man or woman, he said, that is not good question, because this question is not specific. So what are you talking about? Vaccine for who? For you or for other people? Because when we ask for ruling, the scholar will ask very specific, ask question, rather than the vaccine for who? Because the ruling for vaccine is universal, have 5 ruling, right? 5 ruling. It could be when we say halal, is not good enough. Whenever halal, I have to know what halal is, because halal, there are 4 rulings, right? Whether it's wajib, whether it's mandub, or sunnah, they call it, or it is makruh, or mubah. Actually, makruh is below mubah. Mubah is permissible, right? These are halal. Haram is only one, haram. So halal is a very constricting mindset. So I have to know what is ruling, and second thing, I have to know the ruling for me. That's what the scholar have to ask a lot of questions. So I advise myself and you is, if you ask a scholar of ustaz, and if you say, yes, yo ustaz, what is vaccine halal or not? They said haram or halal. You run away from them. You run away from this kind of scholars. Because what you want to know, the scholars at ustaz, that ask you a question, to who are you talking about? To you, okay. To you, I have to ask question about you. Are you immunocompromised? Do you work with this virus? Are you exposed? Are you in betapa in a gunung tak mix with people? Where are you located? All these questions, and then at the end, the scholar will devise whether harm or benefits, your exposure or lack of exposure. So for me, to know the virus is vaccine is permissible, is mubah, it's a waste of time. Why? Mubah is just like wearing this shirt. I don't have reward, I don't have punishment, right? It's a bad business. Why I want to have business doing something that for nothing? If I want to know how to make a ruling that I make a vaccine become mandu, extra credit. Extra credit, I got reward. Because the highest reward we know in our fiqh is whatever Allah make it wajib, right? So for me, working with the virus every single day is wajib. And wajib means I have the highest reward. Now, if you're an ordinary person, you're not excited to do only mubah. Mubah, you have no reward. So you have to make it mandu. How you do this? Change your intention. Change our intention so that, let's say you are a housewife or husband working in the office, you're not in that dangerous, you are normal. So you have mubah, harus, right? But you don't do it harus, you want to make it higher. So you make intention, Allah, I take this vaccine for the sake for my body to protect my family, protect my neighbors, protect everybody that I mix with, Muslim and Muslim. Particularly, those are sick people, the older people, or the youngest people. I want to protect them. I want this vaccine to make me become the shield to protect them, all these people. Then you have mandu. And then your vaccine become meaningful. If you do this kind of mindset, then it compels you, before you have appointment of a vaccine, you have to have wudu, right? You have to have wudu because this is ibadah. And then you take the vaccine with Bismillah and make dua. and then respond to the question. They come like in for 1 week or 2 weeks, respond feedback, bad or good feedback, doesn't matter, because why? Through your feedback, they will learn about sciences, more data about it. So you want to be involved in helping the science, helping humanity to understand the creation of Allah Ta'ala, right? And that's mandu. My point is, my brother and sister, in anything in life, we have to look from a three perspective, three dimensional. First dimensional of the heart, iman. And then dimensional of Islam, the outside. And then we try to go to dimension of ihsan. Don't be people of, Islam teach us to be people of sophisticated mind, but more so sophisticated heart. We have to have a big heart. Why you want to take a vaccine for yourself? You want to take vaccine to protect other people. And this one, herd immunity, I said earlier, herd immunity is to invest in the intention so that you have more reward. You have more reward because fardu kifaya, if you make it your vaccine as fardu kifaya to protect the people, you become the savior of people's life. And to save people's life is the second objective maqasid of Sharia, right? There are 5 maqasid of Sharia: to protect faith, to protect life, to protect intellect, honor, to put the intellect to the honor, and to protect property ownership. And when you save life, you protect all of them. And this is what Islam teaches us. So this is why I said, when you look at the vaccination, the same thing like cooking, do laundry, driving, everything, you have to look at the world through Iman, Islam, Ihsan. And think about, in other words, in a nutshell, in a summary, this vaccine is a habl min nas. We are discussing about habl min nas, but I want to encourage myself and you to change it into habl min Allah, right? Vertical relationship. Now, at the end of the day, it's about vertical relationship. Because I'm not going to, will I die taking the vaccine? Yeah, I will die for any reason, right? But so when you take the vaccine, then you make the intention, prophetic infection. Just like Muhammad SAW take vaccine, what his intention will be. And that is what Islam teaches us. And therefore, when you talk about humanity, you have to have a big heart, right? And this is what Rahmah all about. And that is our Fatiha. I close with that Fatiha. Everything you can summarize in the Fatiha. This virus vaccine or the virus itself are in Alameen. Alhamdulillah, Rabbil Alameen, right? That's the beauty in it. Where are we going? Malik Yawmiddin, Akhirah. So between Alhamdulillah Rabbil Alameen and Malik Yawmiddin, what is the middle? Ar-Rahman Ar-Rahim. So the vaccination, the study, the research, everything that we do in this life under the umbrella of Ar-Rahman Ar-Rahim. That is the essence of saying Bismillahirrahmanirrahim in anything you do. Beside all other dua, Bismillah is the first thing, right? And that is the signature of Khalifa of the world, right? The reason why Allah created us here to be Khalifa. What is Khalifa? Representative of Allah Ta'ala. Therefore, our value system, our worldview, has the same thing with Allah Ta'ala as humanly possible. And that is what meaning to live as a Muslim. So we bring good news. We bring bashir to good news to Muslim and non-Muslim, right? And this is our signature. Inna arsalnaka illa rahmatan illa alamin. We do not send you except to the mercy to the worlds, plural. And I'm very sad looking at the WhatsApps, Telegram, in the social media, Ustaz are making dua against protection against COVID-19 and other things. only specifically for Muslim, only especially sometimes for Indonesian, for Malaysian, sometimes for the Malays, racial. Why are we constricting the Sunnah Muhammad sallallahu rahmatil alameen? And this is, Allah give us this pandemic in front of our eye. In the US, 500,000 people died. We have to wake up and start to examine ourselves and to do with the heart to be open, to make it bigger. And that is the essence of the story of At-Ta'if. So the last advice from me and to you is, look at the dua Muhammad sallallahu did when after he was persecuted unjustly in a Ta'if, right? And look at the dua. And this is our identity as a Muslim. May Allah make us among those people that really understand and walk emotionally, intellectually, and in the heart, go into the spirit of rahmatan lil alamin in anything that we do, biiznillah. Amin ya rabbal alamin. Whatever I say is wrong is for myself, for the right of Allah Ta'ala. Thank you so much for the organizer. There are many people involved with this behind the scene. May Allah bless you all and all the respected elders, Pak Laksamana and the president and all the secretary, or the IMSA and premiers. Allah bless you all. May Allah grant you ease and facilitation in all matters, inshallah ta'ala, all good, biiznillah. Amin rabbil alamin. Jazakallah khair.
Masya Allah, Jazakallah khair, Dr. Azaibi, that you have reminding us that getting vaccinated is also a hablum minan nas, which means mendapatkan vaksinasi adalah salah satu bentuk ibadah kita juga kepada sesama manusia, dan tentunya juga itu menjadi sebuah ibadah kepada Allah Subhanahu wa Ta'ala, dan insya Allah akan membawa kebaikan bagi sesama. Terima kasih banyak atas materi yang luar biasa, inspirasi yang luar biasa daripada pembicara Dr. Alvin Syah dan juga Dr. Azaibi. Terima kasih kepada teman-teman yang sudah bergabung dalam webinar hari ini. Terima kasih atas diskusi yang luar biasa. Mungkin saya mengingatkan sekali lagi bagi teman-teman yang ingin mendaftar menjadi pengurus IMSA student, bisa mendaftar di link yang tadi sudah di-share oleh panitia di imsa.us/register-students. Terima kasih banyak sekali lagi, mohon maaf jika ada kesalahan. Saya mewakili dari panitia memohon maaf sebesar-besarnya. Terima kasih atas partisipasi yang aktif dari teman-teman semua, dan selamat ketemu kembali di webinar IMSA selanjutnya. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh.